1, proposed high-level program budget 2020-2021 for regional committee consultations. We had the presentations from Mr. Imre Holo and Dr. Nedret Emiroglu on this topic yesterday, but we did not finish the deliberation of this agenda item. Delegates wishing to speak on this issue, please raise their nameplates. As I remember, yesterday was a yes from Belgium, please. We start with Belgium, then United Kingdom.
Let's start.
Please, Belgium, followed by United Kingdom.
Thank you, Mr. Chair. Brief statement on behalf of Belgium. Belgium fully aligns itself to the statement made by Austria on behalf of the EU and its member states. We thank the Secretariat for sharing early this first draft of the program budget with the member states. But to begin with, just like several other member states, also Belgium has concerns on the ambitious increase of the next program budget. Our ambition is to have a realistic budget that will be fully funded by the end of its biennium. Secondly, as Norway, Germany, and others pointed out before, we seek more clarity on how the new budget space allocation formula was applied. Considering the changing distribution of health and wealth in the world, we were a bit surprised to see that the budget share under segment 1 for the European region is not increasing to the amount one would have as expected. In our understanding, strategic budget allocation is done following a clear and objective formula and criteria like population level, health status, and socio-economic status. However, as we couldn't find detailed information on the application of the new formula to allocate the budget space to the 6th region and its headquarters, we seek more information from the Secretariat on how this was done. As a last comment, we noted that DG Dr. Traders has the ambition to increase country work. However, in the current proposal of the program budget, the intended increase for country work is actually translated into a budget increase for country offices, not country work. As the European region has many countries without country offices, like Belgium, for example, we wonder how WHO plans to increase country work for these countries. A final question is, considering the presentation of Dr. Nedret and where a new business model was presented, is that we see how it could influence or enhance or support the new budget space allocation procedure. I thank you for your attention.
Thank you, Belgium. I would like to ask delegates of United Kingdom, followed by Monaco.
Thank you, Chair. The UK aligns with the statement delivered by Austria on behalf of the EU and its member states. We thank the Secretariat for the document and welcome the opportunity to comment, although we were also disappointed not to have more detail and emphasise the need for the response on the 5 important issues raised by Austria. This is clearly a new and complex process and not yet complete. In addition to the issues raised in the EU statement, we would like to raise some additional questions on the way forward. First, an indication in terms of high-level allocations, what is still subject to change before the EB version and what aspects are likely to remain the same. Second, given that regional input is incomplete, how many member states are still to input and how and when we would expect that to change the regional priorities. Third, how the GPW flagships under the 3rd billion are reflected within this process, in particular AMR. Without the level of granularity that we have previously received, it is difficult for us to know, and we would welcome further information. Finally, we've already been clear that we see funding for the 13th GPW as very ambitious. While it was good to hear that you think this funding is realistic, when do you hope or expect from the 91% to be at 100% of funding and in subsequent biennia, and how will that be achieved? Thank you.
Thank you. I would like to ask delegate of Monaco, followed by Switzerland.
Thank you, Chairman. Monaco is grateful for the exhaustive presentation of the Programme Budget 2020-2021. We would like to endorse the statement made by Austria on behalf of the European Union and its member states. We take note of the questions asked and issues raised by the European Union representative. We are still awaiting the clarifications to them from WHO, and I can assure you that Monaco will participate actively in consultations which will take place leading up to the finalization of the programme budget between now and the Executive Board session to be held next January. Thank you.
Thank you. I would like to ask delegate of Switzerland.
Monsieur le Président.
Thank you, Chairman. Switzerland is grateful that member states have been consulted on the steps which are to be taken in order to attain the goals of the 3rd billion as clearly defined in the GPW. These goals and contributing to improving global health go hand in hand with structural, organizational and human resource-related management improvements and a possible increase in resources available. The document submitted to us is informative but as yet insufficient to support a decision to be taken by member states. We need more detailed information, and therefore we urge the organization to provide a more detailed timeline with a listing of intermediate objectives so as to boost the credibility of the new program budget and guarantee its practical feasibility. Thank you.
Thank you, Switzerland. As there are no more speakers on my list, I now would like to ask Mr. Holo and Dr. Emiroglu to respond to the comments and questions raised. You have to floor, Mr. Holo.
Thank you very much, Mr. Chair. I will start answering the questions, and then I would like to ask my colleague Bernhard Schwartlander to pick up those issues that I have not touched upon. So first of all, we heard you loud and clear that you are not happy by the fact that only a high-level budget was presented to the regional committee, and you would like to avoid that this happens next time, and you would like to have a document which is more detailed. So I think this is very clear. At the same time, we do have a fundamental timing problem, and that's not actually specific to the GPW, and we will have to think how to work that out. On one hand, we have to have a proper prioritization process, leave time for the prioritization process, then move into costing and cost out the outputs and come back with a budget that is bottom-up and fully costed. At the same time, we only have all the time, basically because of the RC schedules, a couple of weeks, maximum 2 months to do that. And something has to give. So we either, what we decided this time is that we leave more time for the bottom-up process to try to inform more substantially the EB version of the budget, or that we rush the process and come up with something that is not fully discussed. So what I would like to say here is that we heard you, but please note that this is a true headache, and I would like to work basically with you in the coming months and year to find a better solution for the next program budget to be presented at the regional committees that some of these conditions are met, or that we have a better way to deal with that. Having said that, I think it is also important, also because of what you raised, that we will organize briefings and opportunities to have discussions on the draft program budget and to keep you up to date before it is actually published by mid-December, so that you feel that you are informed about the process and the trade-offs along the way. But I don't have an easy solution for that. The second point, which was also raised by the European Union, was about the UN reform levy, and that the UN reform levy is supposed to be a cost-neutral exercise from the point of the member states. And while I have no doubt that for the UN system as a whole, this may be a cost-neutral exercise, for us, there's definitely short-term, immediate cost implications related to that. Just to give you an example, we were just informed this week that the flat, so I'm not talking about the 1%, just the flat contribution to the resident coordinator system will increase from 2.6 million that currently we're paying yearly to almost 7 million. So that's a $4.3 million addition. Plus, there's a 1.5 million increase for security. So just for 1 year, this is 6 million. For a biennium, this is almost 12 million. And that's a contribution that, rain or shine, we have to pay every biennium to the new resident coordinator system. And on top of that, we will have the levy on the voluntary contributions. So the savings, obviously, which may happen at the UN level, don't impact WHO. And from a WHO's perspective, it is seen as an extra cost, and we have to find a way to budget and fund this. And this is not an insignificant amount. And I think you have the right to know how much it is, and I think you have the right to know where it is going to come from. There were a lot of questions about the share of the regional office. And this has two components. One, which is the overall share of Euro as a major office, which I will explain. And then there's another component, which is the country regional office split, which has to do with the Euro business model, and Nedret is going to talk about it. So the way we have put together this budget, and I think quite upfront about it, was primarily a top-down approach. And we looked at the different components of the increase, and we came up with a formula to distribute that proposed increase. As half of that proposed increase is related to polio, and I will talk about it later, that was very much driven by the current polio staffing and the polio programs, and that's why they are not benefiting the European region. For all the other components, so for the innovation and data component, what we did, we said, this is the amount we need. 60% of that will go to the regions, and that 60%, we divided it equally across all the major offices. So that gave one figure for Euro, that Euro would build into their planning at a later stage. For the country strengthening component, we took the strategic budget space allocation percentages foreseen for 2020-21 and applied it basically on the 130 million, and that was distributed then based on that, and that the Euro share was in line with that. So overall, I think it was done, and we've had a consultation about that with the GPG in a quite a transparent and logical manner. And please don't forget that at the end of the day, maybe it's less increase than what you would have maybe expected, but it is still quite a sizable increase for the European region. There were also questions about polio transition, and I think I just had a discussion with someone before. One of the biggest problems with polio transition is the whole language that we use. Because what we really are talking about is not polio. What we're talking about are maintaining essential public health functions in country offices, mostly surveillance, immunization, and laboratory capacity, which were budgeted and funded from polio earlier, but from where polio, because these countries are declared to be polio-free, are withdrawing. So there you have the issue that how these core capacities will be maintained and funded in the future. And what everybody has been saying before is that these capacities need to be maintained, or part of these capacities need to be maintained. And so what we're doing is we're budgeting these capacities in, or a part of these capacities in the base program, which we should have been doing earlier. And then we hope that we will find the resources for that. In order to, and rightly so, everybody is skeptical whether these capacities will be funded and whether we believe that polio automatically will fund that. That's not our assumption. So just because we call it polio transition, we should call it really core public health functions, and our assumption is not that the polio program is going to fund this. What we're saying is that these are absolutely essential capacities that the emergency program, that the surveillance program, that immunization rely on, and we cannot afford to let these people go and let basically the ball drop. And in order to define the need, we have to budget it first. The second step is then to go out and find the money and identify donors or core resources to fund this. For me, the way I see it, these capacities have to be maintained and non-negotiable. So we will have to find the resources to do that. Otherwise, I think it's a major health security risk for the whole region. And the last type of questions that came up was generally about how realistic is the budget, and can we, in this very difficult environment, expect that that we can have a 12% increase in funding, and how realistic is that? This is always a judgment call, and at this point in time, it's very hard to predict. We are very confident in our resource mobilization capacity, and we're very confident in the realisticness of our ambitions. But this is the time to set the targets. If we're not ambitious setting the targets and setting the goals to fulfill and implement the GPW, then we will never achieve them. So what we're asking is that don't cut our wings yet. Otherwise, we will never be able to aim higher and fly higher. But we're absolutely aware that that this is not going to be easy, and we can only do it if we have the trust of our donor and the confidence of the colleagues we're working together with. Bernard. Yes.
Okay. Yeah, thank you very much. I just have a couple of points I would like to add, and I did have a further discussion, of course, with Dr. Tedros, our DG, before conveying some of this to you. One, I think, and of course, Imre has already mentioned that it is an exceptional year. We passed, and I say we because the World Health Organization is the member states and the Secretariat, we passed a very ambitious, innovative GPW 13 just 3 months ago. The reason why I say this and remind us is that inbuilt in this GPW is, of course, a very strong element of reform, of ambition, which in many ways has to be reflected in the way we structure the budget, and we also ask for money. Now, there's a number of things are in there, and one is really an absolute commitment to do more than lip service, that we want to build the budgets country up, bottom up. This is not entirely new in the debate of the governing bodies, of course. I mean, this has always been on the agenda for a long time, But we are absolutely committed, and the way you see the budgets are structured, it really starts, and we want this to start in a serious way, with the upcoming budget. Now, that of course, and the things that Imre mentioned, make it difficult to do it in a timely manner to provide the input for the governing body discussion as we see now. But I would like to ask that you bear with us and work with us, that we actually work it through and make it happen. It's in all honesty an approach to strengthen our links with countries, to build this up from that level, and to make our organization collectively stronger through that. So the second point, very briefly, on the RC system and the UN reform. We mentioned it yesterday, and I mentioned it myself. I'm now sitting on these discussion groups and working groups a lot myself, together with Tedros for him. And I must say, I'm actually very impressed. I've personally worked, and I will come back to that later, as a WR, and had a great time. I've worked under some of the worst and some of the best RCs, or with some of the worst and some of the best RCs. And I feel that there's actually a change in how the discussions are going. It is very clear that the reform has been decided. It's not a question of whether it happens, because the member states have taken these decisions. There will be a new RC system, and we are absolutely committed to work with this and learn together, as I mentioned yesterday. But what I think the most important point is that I perceive a change in how these discussions are being held also within the UN. And within our other, brother and sister organizations, also the specialized organizations, where there is a general feeling, and it took some time to get to that point, that we collectively want to make this work. And that has impact on some of the budget discussions, but we just have to make it work. And in the end, we do believe that, collectively do believe that if we do the right things, despite, there may be an apparent increase in the budget, but the efficiency gains will pay off for that if we do the right thing. So again, that's a personal reflection, but I think it's quite important to see it that way. Certainly for me it's important also as we engage with our colleagues in the Secretariat in that, because there is lots of concerns, and we have to do our share to actually educate the systems. And we had a meeting with the WRs who are here in this room today with you, the WRs of this region, about 30. Great discussion, and it was one of the WRs who actually suggested we have to work with the new RCs to educate them how important health is within the development agenda, and this is exactly what we should be doing. So let's embrace this. The next point, and clearly, and Imre has already mentioned that, we hear you loud and clearly that you would like to understand better how this new country model will work and how the resource allocation will work. I've had some general comments on this exceptional status and where we stand, but I want to say two things. One is a more organizational response, and one is a more personal response. The organizational response is, yes, absolutely. We have no intention to keep this away from you. We are very happy to discuss. We're looking for opportunities, and there is, of course, an opportunity to discuss this in the EB under, I think there's an agenda item 7.1 in the upcoming EB meeting, which is titled on the reform, but that could be a very good home to take such discussion further. I want to also be very honest. I've checked back with my colleagues in Geneva. For us to actually properly prepare for that in line with the governance proceedings, we would need to submit a strong paper on 4 October. That, of course, will be very difficult. We can submit something, but again, it's the same thing. How do we insist on having these things in time and having the right information with you, but also getting it right, because we're still working it and unfolding on it. So we have to, I will take this back and will discuss with my colleagues how we can do this, because some of the real issues we will still develop and sharpen over the next few months. And it will be difficult to really deliver on the 100% commitment to have papers in time that the DG has made, and we try to really, really do our best to live up to that, and also getting the right information to you. Now, one of the reasons why I'm saying this is that we should collectively look for other ways of actually sharing information better. We have briefings that we can do. We can individually talk, of course, so that the door is always open. So let's work it through, but clearly we hear your plea for more information on that, and we are committed to live up to that. On a personal note, and I think I speak for my WR colleagues, and I say as a WR because I was a WR until I took the current job pretty much 1 year ago. I woke up in the morning thinking, how can I improve my work to support the plan and the strategies of the Ministry of Health and other ministries in the country I'm working on. I had no other agenda. So what I want to say is that my agenda, the agenda of a good WR is nothing else than advancing the health in the countries that I'm working on. So I would hope that we can actually come to a discussion which is less, well, you tell us what you do, to how do we collectively improve that collaboration and that working together. And one of the things that I would propose is that you have, and I like this, that I like that all of the WRs are in this governing meeting, which is not the same in all of the regions, but make use of our colleague WRs of being here to have that discussion. I like the idea that board members travel to countries within the region, but also outside the region, to better understand how we really work in different situations. And I think what you will see is that we are not, and then my colleague yesterday mentioned it, we're not a McDonald's, we're not a supermarket. That means we have the same portfolio wherever we go. We offer the same things. We are there to actually target our work to exactly the situation we are in. So there will be, it's not a one-size-fits-all, it is really the capacity that we need to respond to the needs of a given country, given situation. Now that actually brings me to the point of Belgium. You asked, what are we going to do to help you? I was just looking, to work with you. I think the DG mentioned yesterday en passant that he wants WHO to go global. And what he meant is that this cannot be an organization, and fundamentally is not an organization like the Global Fund or others where we have donors and recipients. I would strongly refuse that, because we are a member state organization, it's a partnership. Now, whether we are in a country which is challenged with resources, or we're in a country where we have the richest country of the world, or a European, let's say Belgium, in all countries, there's challenges in the health system. So we are committed, and it goes back to my previous question, to really analyze with you and engage in a policy dialogue. What are the challenges in your specific country? What are the challenges in Belgium to make sure that we keep universal coverage what it should be, that everybody has access to all the essential services they should have without financial cost. And that discussion in Belgium is very different from a discussion in Germany, from a discussion in Belarus or in other places, or in Africa. But it is an important discussion. We want to be a partner in that discussion. You don't need to have a country office in every country to do that, right? This is why we are a global organization, so that's one of the things that we really want to push for, and you see that in the GPW as what we call the policy dialogue, which is similar to what the IMF does in Article 4, that we engage with our partner countries in a real policy dialogue, and that's targeted at the local situation, and that should be, in the principle, the same wherever you go. I think that's it. Anything else?
Maybe that was just one, because there was two questions from the UK that I didn't address. One was about AMR, and the other one, what is going to change? Just to be very specific, so what I'm not expecting major changes in major office allocations, so this envelope is done. What we're doing right now is to basically, by the prioritization exercise, the country support plan development, etc., to basically fill the envelope by the strategic priorities. And you need an envelope because the bottom-up, it's never a pure bottom-up planning exercise, so that countries and regions, they need to know what the realm of possibilities are, and they have to basically come up with their priorities within that. So my expectation is that there's not going to be major change in this. And the other issues, AMR and the flagships, they're very, very important. And what we're doing right now is we're breaking down, because the strategic priorities are very big. Then we have the outcomes, which are still at a relatively high level. What we're breaking them down is to outputs and what are the actual deliverables that we're producing. And of course, AMR is figuring extremely high in this agenda, and I hope that you will have enough granularity and details in the next iteration of the draft budget, that you will see what is it that we are doing in these areas, including also other flagship areas like NCDs, communicable diseases. Thank you.
Thank you. Nedret, please.
Thank you very much for all your comments, questions, and guidance on the way forward. I would like to give you an update from a European perspective now. The first issues that I would like to address is where we are within the European planning process. That was the question, and what is next. It's a combination of what we have presented yesterday and also in response to some of the questions. So far, 35 member states finalized the prioritization process and either confirmed those back to us officially or in the process of providing that official information, which means 18 member states are remaining. 4 to 5 is at the final stages. So how fast we could go with the European details, as I was mentioning yesterday, is really depends on how fast you member states report us back your prioritization. Please do so. As the Secretariat, we are ready to be able to provide any support you need. And as the next step, we suggest is share with you all the information we have, as the details we have been showing you yesterday at the strategic priority level, at the outcome level, as well as the scopes and the outputs, which will be prepared for the EB version mostly, is going to be a way of demonstrating you, as Imre was mentioning, some of the cross-cutting areas or technical subject matters like AMR and NCDs. So in terms of the next steps in the planning is, as soon as we have the reporting back from all member states, we suggest to share that information with the member states, possibly under the governing body structure, standing committee for the regional committees oversight, and then sharing that with all the member states. Of course, in parallel, we have to start the process also in the detailed planning, which is going to be the version going to the executive board. Then that brings me into the second set of questions where it was linked to how do we capture the work of WHO, what is the country office, regional office split, and how do we work in the countries where there is no WHO presence. So I would like to go back and remind you again with the European business model. So this is not new. We have been working with each and every member state within the region for so many years. And there are mechanisms to be able to do it. What we call is the multi-country or inter-country delivery modes. And there has been a number of different also networks and platforms like the Small Countries Initiative or the Southeastern European Health Network, which also brings the countries with the country offices and without the country offices. So I want to assure you that we will take all member states equally and we will work with each one of you. But of course, the level of the support, whether it goes from a policy dialogue and policy guidance to strategic collaboration and discussion to the technical support and assistance, is going to be different. So those are the details we are trying to get from the bottom-up prioritization, which is going to be able to define what kind of also staffing profile we have in the regional office, in the geographically dispersed offices, which is the additional technical expertise to be able to help the regional office, as well as the country offices. And as an interim mode, we are also thinking of a multi-country approach, which brings the technical level of expertise in one place, which is going to be able to serve as teams for multiple countries. So those plans are going to be finalized as we get the bottom-up planning process finished, and we have been prepared for that. And that will also have some implications on how we are going to be splitting the Euro budget envelope as regional office and country office as the share. Thanks for raising the Euro share, which we really appreciate. Of course, we listen to you, and we will be continuing the discussions, particularly in the, I guess, the how the polio is going to be able to be assessed. So the distribution of current thinking of the polio funds is going to continue, and it depends on also how the donors see what will be the distribution, whether that support and assets going to be localized and focusing on the 17 high priority countries, which is the current thinking, whether there could be some room for other regions to be able to get that support to be able to strengthen the emergency preparedness or basic surveillance, communicable disease sort of functions. Then again, as an additional response to the question from UK, how we are going to be able to address also the contribution from the member states which do not have a country office, or on the cross-cutting areas like AMR and NCDs, and we really appreciate the European leadership on that. That is also the mechanism we are looking into, whether we could capture that in a inter-country mode of work plan, which will look into the regional and global public goods and bringing multiple countries together to move the regional and global agenda further to be able to creating the momentum. In terms of funding for financing for 2016 and 17, of course, the good news is that WHO is overall financed at this stage as the 91%. At Euro, we are at a 66%, 2018-19 financing. We are funded at this point as 66% in the European region. We are discussing with the global level at this stage to be able to see which we are sure those funds are going to also be delivered to the European region as well. So I think I've covered
Thank you very much, Dr.
most of the
Nedret.
questions. Thank you, President.
With this, we conclude our deliberation on this agenda item.